Hey everyone, it is Kevin Henry, founder of the Dental Assistant Nation and host of the Dental Assistant Nation podcast. So glad that you've joined us for another episode, and so glad to be joined by a dear colleague of mine in the dental industry, and that is Melinda Hereford. Melinda, how are you today?
I'm well, Kevin. So nice to be here with you today. I love this podcast that you do.
Well, thank you. And I love that you have a heart for dental assistants. That always makes
I
me happy
do.
when my friends who are out there making such big differences in the lives of dental practices know the importance of dental assistants. So, we're going to get into it and talk about that here in just a minute, but I want to make sure our audience knows a little bit more about you before we dive in today.
Beautiful. So, Kevin, I have been consulting for over 3 decades. Now I just know over 3 decades, but I started as a dental assistant.
Awesome.
And so that probably is where my love comes from. This dental assistant piece is, I really got my passion for dental care and the work that we do from those early days being a dental assistant. And so now I we work with teams. I have a team, and we work with dental offices, and we really work with them to have them kind of shave down all their responsibilities and focus on the most important things. I mean, we have a lot to do, let's face it, and so we try to simplify what they do so that they can do that more effectively.
I love that because we know how short staffed dental practices are today. We know how busy assistants and everybody else in the practice are as well. So tell me, how do we figure out what's important? How do we shave that down? I'm going to throw you a big 30,000 foot view question here before we really get into the
Yeah,
weeds.
yeah. Yeah, I love it. Thanks for asking because after years of consulting, and I mean, I had 44 systems that I trained on, Kevin, which was like crazy, right? Doctors would go, "Are you kidding me, Melinda? Really?" And so I did a goal setting process for years, but it was like we would come up with a list of like 100 things, right? But Jim Collins says this: if you have more than three, you are not going to follow through. You will not
Mm.
be effective, right? And so it's like, okay, well then let's pick one wildly important goal. So we work with our clients to pick that one wildly important goal. Usually it's an overarching goal, but the one wildly important goal, and then each team member has 1 to 3 things that help drive that wildly important goal. So, in addition to patient care, they're focused on those 1 to 3 things. That's it. That's it, right?
That's great.
Because patient care is consuming. I know it's lean, and and because it's lean, it's easier for people to remember, and it's also easier to get really good at that 1 to 3 things and to remember it.
Well, and narrowing that focus, I think, is so important because you know from experience, and I hear so often, dental assistants are doing a million different things to try to make sure that not only the
They
practice
are.
keeps going forward, but they're answering patient questions. They're trying to help patients have a better visit. There's a lot of different things that they do. So narrowing it down, I love that concept.
Yeah, it's a beautiful thing, and you're right. Dental assistants. I counted the steps of a composite the other
Mm.
day. It's like 100. It's over 100 steps that need to be executed in that
Oh
procedure.
wow,
Isn't that
that
crazy?
is.
That's just one procedure. That's just one procedure. So, dental assistants are experts at anticipation and follow through. That's what they're experts at. Of course, the cleaner their setup, the better everything goes, right? When
Absolutely.
they're 100% set up, life is good. And so in addition to that, really I feel like that dental assistant is the communicator with the patient and the doctor about what's next. And so, it's easy to get into a procedure, Kevin, and it's like we're just there to do what we're doing today, and then the doctor dashes out. They finish, they dash out, and then the dental assistant kind of gets their stuff together, and what they say, we'll see you next time. And then the patient goes up to the front desk and they go, what's next?
Yep.
Do you know what I'm saying? We call those mystery patients, right? It's like the surprise. So, really, the dental assistant has control of that whole interaction by doing their chart check, by anticipating the day. And so we have that system of that they look. There's one assistant that's responsible for looking at the restorative schedule, depending on how, per doctor, and they look at not only what is expected today, what are we doing today, and make sure all that stuff is here, but also they look at what's next for the patient, what's next on the treatment plan, what's next in their continuing care, what's next, so that they prepare all of that on the route slip and they get that all set to go. So in huddle, they're like, here's what our game plan is for all these patients. And then when the doctor's finally in the operatory, the dental assistant actually runs the whole show. That's my favorite,
I
right?
love
I
that.
I think they're awesome traffic coordinators. They're awesome. We don't want the doctors. I mean, the doctors don't have time to do that, but the dental assistants do. And so, like, okay, you're the captain of your room. What happens in your room? And it's not only what we're doing today, that whirlwind of patient care, but it's also what's next. And really, I have those dental assistants body block the doctors before the doctors walk out of the operatory. Literally, Kevin, body block them until the doctor sets up the next visit. So, it's this idea of the power in the communication,
Mhm.
right? I think you're so right where I mean, dental assistants kind of get forgotten.
Yeah, they do.
They get forgotten. They get forgotten, and they certainly um, don't own the space really in team meetings or in team trainings. you know and so really it's like, well, what if the assistant was actually the most critical in the daily flow? What if that were true?
I love that world. I gotta be honest, that multiverse that we're talking about here where the dental assistants run it, I think that's fantastic. And I wanna go back to a word that you just said a minute ago about own. What you're talking about is really
Yeah.
that ownership of the operatory, and if they're gonna be those traffic
Yeah.
controllers, is making sure that everything actually lands properly. So I love that
That's
concept for
it.
sure.
That's it. And having some people get this naturally, but they can see not only what's happening in this moment, but they can see out around them, right? And those assistants, really, that ability to see out around you, it's like a good waitress, right? That good waitress can see all the way around them. They can like anticipate people's
Yeah,
needs, and that's what an assistant it does when they own their world, right? When they own
love
their
that.
world, they're like, okay, you're coming in here. This is what we're doing today. This is what's next. And it really is taking control of the room. Doctors love it when the dental assistants do that. They love it.
Yeah.
I mean, sometimes they have to get used to it, but they're like, wow, cool. All of a sudden, they just have to go wherever the dental assistant tells them to go. I mean, it's beautiful,
It
isn't it?
is, absolutely. And I wanna reference another podcast that you were on with a mutual friend of ours, Dr. Lynn Tao, because one
Yep.
thing that you talked about with Lynn so much was about alignment in the dental practice. And what I'm hearing
Yeah.
is that when everybody kinda knows that 1 or 2 things to focus on, and everybody knows maybe each other's 1 or 2 things that they're focusing on, that really does, I think, hone
Yeah.
down and bring that alignment, right?
It's beautiful. It is. It's beautiful because then when you're all headed in the same direction and you're going for the same thing for each patient, then it really does feel, people talk about feeling like a
Mhm.
family, then it really feels like an awesome family, like a functional family, right?
Absolutely.
Where everybody knows what they're doing and they can count on each other for the next thing. And so, I came up with this I didn't come up with the 20%, but the 20% that makes the 80%
Mhm.
difference, that's what we use to to inform us with our clients. What's the 20% that makes the 80% difference for each position? And so the dental assistants are like that. Once they nail the details in their room, it really is communication. And when they're a step or two ahead of the doctor, then really the doctor, because it's hard also for those providers. Their head is up, they're down focusing,
For
their
sure.
head is up again, and then they got to go do the next 3-minute exam. And so the more we can really be the leader of what's happening and kind of lay it out for the providers, then we do get that well-oiled team that I think we all want. I think everybody wants that.
Absolutely. And so here's a big question for you, and not to put you on the spot, but I know that I hear this all the time from assistants. They want to have that ownership, but often it's talking the doctor into it or making sure he and she
Yeah.
understands why that's important. How do those assistants in that situation maybe get that buy-in from the doctor to start shaving things down toward that focus?
Yeah, beautiful. I think that's it. It's that whole conversation. How do they drive it?
Mhm.
And, when you talk about ownership, Kevin, I think that's a piece of it, which is like getting really clear of your value, getting really clear of your value, and getting really trained around your value. So it isn't just about the patient right now. It really is about anticipating what's
Mhm.
next. You will get the ear of the doctor if you can line it out like that, right? In other words, I want to make your job easier. Here's how we can make your job easier, and here's what you do in that process, right? So I love that thing about being unapologetically confident.
Mm.
Have you heard that
I
term? I
love
love
that.
that, being
Absolutely.
unapologetically confident. And so I think that's really what we're working on with our dental assistants, and really all of our team is up leveling their confidence, and in a humble way, in a humble way. But really it's like, if it wasn't just about taking care of this patient right now, because I think that's where our focus goes.
Mhm.
And I call that the whirlwind, right? That's the urgent. From it's the stuff we have to do. We have to take care of that patient right
Sure.
now. And if we can focus on the one or two other things that are a priority, they're important, they're not urgent, they're important. If we can focus on that and stay grounded around that, if we can do that, our days are smoother. When our days are smoother, everybody's happier. So this is, not only are we more productive, but it's a calm productivity, right? It's not that manic, crazy who's on
Yeah.
first thing where everybody's like, it's confusing and chaotic.
Yeah.
This is really like, no, no, it's like, what is next? And do you have that appropriately documented so that it's very easy to give that to the next person in line to that pass off. That pass off is critical. And so when we talk about patient communication, right, that they lead the doctor in the room, and then they very eloquently come up and they say to the front desk, they say, gosh, it went great today. This is what's next. I think we have something tomorrow. If we do, let's get that taken care of tomorrow.
There you
Boom, and they're out, right?
go.
Yeah.
And I
So it is clarity.
and
Go ahead.
no,
Yeah, it
no,
is
I
clarity.
no, and I just wanted to follow up on a question because I think it's important that the patient hears all this as well. You mentioned that a few minutes ago about, that mystery walk up front and everything. But when a patient knows, not only does that assistant have his or her best needs in mind, but they're also in control of that situation, I think that's a very comforting feeling for the patient too.
It's wonderful, right? I mean, people know when you're
Mhm.
organized. They know it. They know when you're making it up in the minute, right? They know it. And they may not be able to articulate it, but they know it. They can feel it. And so that you're all ready for them. They're like, wow, wow, woof, this is good. This feels good. And then we do say that we like our team members to be repetitive about what's next. That's for the patient. That's not for us. That's for the patient. But when you talk about confident communicators, that's really what we're talking about. Like, we know what's next, we confirm it with the doctor, we say something in the operatory, and then we say it again up front. Our patients need to hear that message 7 to 20 times, Kevin. It's crazy.
Wow.
Because we're getting so many crazy marketing messages, it's now up to 60,000 a day. Is that
That
insane?
is.
So we're competing with all that. We're competing with all of that. So our patients don't remember if it's the right side or the left side, or they don't. They're just trusting us to show them what they need on the camera and then help guide them through to choosing their health. Right? That's the in essence, that's what we're doing. Let's make it easy for the patient to say yes by setting ourselves up with success.
So, Melinda, if there's one thing that you could wish for Dell Assistants to really focus on the rest of the year, what would you say that would be?
Yeah, I think the focus would be believing in their voice. Like, the voice of the assistant makes such a difference with the doctor, with the patients, with your team. I really feel like the dental assistants are the heart of the organization, where the love comes from. And, and usually they have lots of experience. So it's that piece of believing in yourself. Take continuing education courses, find your voice, and know that your voice matters.
Well, I know you just got a lot of love from Dell Assistants for saying that, so thank you. And I want to make sure our Dell Assistant audience and even our dentists who listen can follow up with you if they've got questions. So where's a good place to find you, Melinda?
It's easy, Kevin. It's my name, melindahereford.com, or Melinda Practice Management Consulting.com. So super easy to find me, and I welcome the reach outs.
Well, and we'll make sure all that is in the show notes so that you'll find Melinda very easily. I know personally she's available on social media as well, so not too hard to find. Melinda, thanks so much for your time.
I'm around.
You are.
Thank you, Kevin.
You bet. And thanks to all of you who listen to this episode of the Dental Assistant Nation podcast. We so appreciate you, as well as people like Melinda in the industry who know your value. Until next time, Kevin Henry signing off. Wishing you nothing but success ahead.